Dengue fever. Dengue fever is caused by dengue virus. These are arbovirus capable of infecting humans. And this dengue virus caused by Aedes aegypti mosquitoes. This is the vector of dengue fever. Dengue fever classified into three forms. First one, classic dengue fever, or second one, dengue hemorrhagic fever without shock. Third one, dengue hemorrhagic fever with shock. Dengue fever, otherwise known as breakbone fever. It is the common question in PSCs, breakbone fever. So, in classical dengue fever or classic dengue fever, the person will show the common signs and symptoms. It may affect both men and women. We can see the signs and symptoms of dengue fever. When we are checking the signs and symptoms of dengue fever, mostly the patient will have fever. High fever will be present. Then redness of the throat, pain in the bones, that is arthralgia, will be present. Anorexia, that is loss of appetite, will be present. Then vomiting tendency, mostly the patient will have vomiting tendency along with blood, abdominal pain. Then redness of the eye, because it's a viral infection. Mostly when viral infection is present, there will be redness. Then when we are touching the patient, we can always feel the warmth or heat. Then rashes will be present. Usually these rashes, it appear in the chest first, then it will be transmitted to trunk and may spread to the extremities. That is the way the rashes will be spread. Next one, there will be rapid pulse. The patient will have high fever, that's why the pulse will be elevated. Then the person will have dizziness, hypotension, then adynamia. It is nothing but it is lethargy. The patient will say, I am very tired, I am not able to do anything. So the person will be confined to bed. So this is the common signs and symptoms of dengue fever. And this classical dengue fever, it will be subside within a few days without any treatment, and mostly this will be occurs. The incubation period of this dengue fever is 3 to 10 days, and without any treatment it may subside, the classical dengue fever. Okay, and another classification of dengue fever is the dengue hemorrhagic fever. In dengue hemorrhagic fever, it's a severe form of dengue fever caused by infection with more than one dengue virus. So here there will be more than one dengue virus will be affected this patient, and incubation period will be same, that is 4 to 6 days or the 3 to 10 days, and the symptoms will be vary along with classical dengue fever signs and symptoms. These persons will have the hemorrhagic tendencies, like there will be positive tourniquet test, there will be petechia, ecchymosis, purpura, bleeding from the mucosa, gastrointestinal tract, injection site, and other locations. Then hematemesis will be present. The person may vomit blood, or there may be chance for the melena, blood in the stool. Okay, so all these features may be present along with the dengue hemorrhagic fever. That's why we are saying it's a hemorrhagic tendency. And here the thrombocytopenia will be present. Mostly the the thrombocyte or platelet count will be less than 1 lakh millimeter cube. And here the evidence of plasma leakage because of increased vascular permeability manifested by at least one of the following. So here when we are assessing the hematocrit value, it will be elevated, and the signs of plasma leakage will be present, like pleural effusion, ascites, hypoproteinemia. All these features will be present with dengue hemorrhagic fever. So that is the main differentiation from dengue, classical dengue fever and dengue hemorrhagic fever. In dengue hemorrhagic fever, there will be increased hematocrit level, then thrombocyte level will be decreased, and hemorrhagic tendency will be high. So, based on the signs and symptoms, the dengue hemorrhagic fever, it is graded to four forms. We can see that. In classical dengue fever, we have seen that this patient will have headache, retroorbital pain, that is pain in the eye, and redness will be present, myalgia will be present, arthralgia will be present. Along with that, there will be leukopenia, thrombocytopenia. Right. So that is the general features of dengue fever. But in case of dengue hemorrhagic fever, the first category or grade 1, the person will have the signs and symptoms of dengue fever, along with there will be positive tunicate test, and thrombocytopenia will be present, and platelet count will be less than 1 lakh. Then dengue hemorrhagic fever grade 2. Here there will be signs of dengue hemorrhagic fever, that is signs of dengue fever with spontaneous bleeding. So spontaneous bleeding means when we are giving injections from that site, there will be bleeding, or from the mucosa there will be bleeding. Okay, so from the abdomen there will be bleeding, so there will be spontaneous bleeding. That means the patient platelet count will be again decreased. Mostly when there is spontaneous bleeding, it will be less than 50,000. Platelet count will be less than 50,000. Then dengue hemorrhagic fever grade 3, the person will have above signs and symptoms plus circulatory failure. So it will be some more severe case. Here the person will have the circulatory failure. So it will be manifested by rapid and weak pulse, narrowing pulse pressure, or hypotension. And when we are observing the patient, or when we are touching the patient, there will be cold clammy skin, and the patient will be agitated, or restlessness will be present with the patient. That is grade 3, along with the circulatory failure. The thrombocytopenia is continuous here. Then in case of grade 4 dengue hemorrhagic fever grade 4, there will be profound shock with undetectable BP and pulse. So grade 4, that is the profound shock stage, and here the person will not be identified the blood pressure or pulse. So in this condition the patient will be die. We can't save this patient. So this grade 4, that is the dengue shock syndrome. Okay, the all above criteria will be met, along with the shock manifestation will be present. Okay, that is the classification of dengue hemorrhagic fever. So here usually the dengue fever, it may present with signs and symptoms, that is fever, usually high grade fever, and the person will have abdominal pain and nausea and vomiting, and there will be eye symptoms. The person will say the eye pressure and photophobia and severe headache. Okay, and when we are assessing, there will not be that much decrease in platelet. From gradually, the person condition may be vary, and here the thrombocyte count will be decreased, and hematocrit values will be increased. Then the person will be show the symptoms of hemorrhagic changes. Then the next, if we are not identified the case, again the person will goes to the stage, the third stage, that is circulatory failure. In circulatory failure, all the symptoms, all the system will be affected, and the person is in danger, and here the person is needed emergency treatment. Then in fourth stage, definitely we can't serve the patient. That's why we are saying that due to dengue, 1 in 12 minutes patient is dying. So usually this dengue fever common in rainy season, because the breeding is very high in rainy season, and it is transmitted by Aedes aegypti. I hope you understood something regarding the classification of dengue fever. Thank you.